11 reasons to read DCR this September. First, a reflections contribution by Dr. Haran Abkarian, whose photo is on the journal cover. Second, a viewpoint: is respiratory protection needed for all anorectal cases that generate smoke? A very sobering thought. 3, a resident's corner and commentary on organ preservation in rectal cancer. 4, our didactic video collection this month with medial to lateral lap LAR. Watch it on the DCR YouTube channel. Are you a subscriber yet? 5, updated ASCRS clinical practice guideline for the management of rectal cancer. Read all the updates. 6, complications following flap reconstruction in pelvic exenturative surgery. 7, abnormal neuronal response to rectal and anal stimuli in rectal cancer patients treated with chemoradiation and watch and wait. 8, survival in IBD patients with rectal cancer. 9, gender variations in mortality with diverticular disease. Do women do worse? This is accompanied by a very thought-provoking editorial. 10, long-term results of robotic-assisted surgery for the treatment of multi-compartment pelvic floor prolapse. And lastly, 11, a meta-analysis of postoperative mortality and stoma reversal rates after total abdominal colectomy versus loop ileostomy and colonic lavage for C. difficile colitis, and so much more in this month's September issue. Thank you.